Well, hi everybody, and welcome to the Nurse Scientist channel. I'm Will Martin. So how has the pandemic affected you professionally? For some people, they've made some pretty big changes, and in some cases, they've left the hospital. In some cases, they've taken travel nursing assignments. In other cases, they have started their own business. So a newspaper article from the Chicago Sun-Times illustrates some of this, and it's entitled, "Despite Fluctuating Pandemic Pay, Stress and Fear, Some Nurses Shift Gears to Stay Loyal to the Profession." During the past 2 years, Enya, 40 years old, was able to set aside money to finally start building a medical uniform business she'd long thought about creating. "If it wasn't for the extra income, it could have taken me so much longer. I probably wouldn't even have ever felt that I could take the risk or take the leap in doing it," Enya said about starting her business, which is called Dima Collective. "It was always an idea that I had for years." Sometimes it takes something like a pandemic to make you really start to think outside the box and look at other ways that you can earn an income aside from the way you were doing it pre-pandemic. In fact, Enya said her pay tripled at times during the pandemic, ranging from $3,000 to $6,000 a week. But other nurses who work in Chicago area hospitals, whose pay either fluctuated or was outweighed by stress, exhaustion, and the fear of catching COVID, say they're still hoping wages and benefits improve in their workplaces. Now, in my case, because the emergency department really emptied out during the first part of the pandemic, we all took pay cuts, we all lost quite a few benefits, profit sharing, 401k contributions, all of that was cut off for several months. In May 2020, during the coronavirus pandemic, the median yearly pay for registered nurses was $75,330 across the country, according to the U.S. Bureau of Labor Statistics. The median yearly wages for nurses in hospital settings was typically more, $76,840, than those that worked in nursing and residential care facilities, which amounted to $68,450, according to the agency. Nurses that I work with are telling me that pay is probably the number one reason why they're thinking about leaving the profession, which I find interesting because, to me, I've always thought that scheduling is probably the most important thing, with pay and benefits coming in second. But we'll see. Throughout the pandemic, many nurses in Chicago and across the country demanded more money and better benefits and protections from their employers during rallies and work stoppages. Falguni Dave, a nurse at Stroger Hospital, took part in a one-day protest in June 2021 during contract negotiations for Cook County Health registered nurses. They were able to secure pay increases ranging from 12% to 31% that will take effect during the duration of the 4-year contract. But Dave said she and others still want the county to meet their promise of fulfilling staff nurse vacancies. And this is the other part of the equation. I mean, pay is important, scheduling is important, but also you have to have enough people working with you in order to make your workload a little bit lighter. Aside from pay, that's probably the biggest complaint that I've heard from nurses that I work with, is that they don't feel safe, they don't feel that they have enough nursing colleagues working with them to maintain safety in the emergency department, or for that matter, anywhere in the hospital. The county management and the HR department had not really wholeheartedly put in a true effort to recruit, hire, and retain nurses, Dave said. Recruiting is definitely a challenge when the travel nursing agencies are paying so much more than staff nursing positions. How do you really recruit people that aren't already working at the hospital? It's a really tough question to answer. About a year later, the stress of the job led Dave to decide to take a demotion and a pay cut to instead work in the hospital's intensive care unit. Dave said she thought about leaving the field entirely, but didn't want to leave in mid the pandemic. So here's an example of loyalty to her coworkers. She didn't want to leave during the pandemic, but she also needed to leave the position that she had been in and decided to go to the intensive care unit. I find it interesting that she says that it was a pay cut to go to the ICU. I would think that maybe it's a pay cut, but it certainly isn't less stressful going to the ICU. It started to affect me physically, emotionally, because it gets tiring after a while. You're dealing with all this stress at work and you pretty much have no support from management to help change any of the situation, Dave said. And this brings up a good point. How's management been supporting you throughout the pandemic? One of the things that made Dinesh, who asked that his full name not be used, to leave his job as a nurse at a Chicago area hospital and return to travel nursing was that how his shifts changed during the pandemic. He would sometimes be called off when he was scheduled to work, and other times would be moved around to different units than the ones he typically worked. And I can relate to that from back in the day when I worked at the bedside as an RN, and when I would have to float to another unit. Typically, they would float ICU nurses to other ICUs, but when you're so used to doing the type of work that you're doing, and you come into work and pretty much get sent somewhere that you haven't been in a long time, and you're dealing with a different type of patient, let's just say it's nerve-wracking to say the least. For Dinesh, the flexibility to take time off was one of the main reasons why he became a travel nurse. Although he said his pay increased, he also relocated to a different state with a higher cost of living than Illinois. If after a contract is done, if mentally I'm just checked out, I can take off 2 weeks before I sign my next contract, Dinesh said. Versus like staffers, you have to put your paid time off request months in advance that only will get half of it approved. So again, to my point, I think that scheduling is probably the #1 issue for most nurses. I know it used to be for me, and probably a close second would be pay. Stephanie Mendoza, a labor and delivery nurse in the Chicago area, says she's gotten temporary pay raises throughout the past 2 years, but none made a significant difference in her family's overall finances. And while she knows how much more nurses who have left their position to become travel nurses make, Mendoza said she has no plans to leave her job. And I think this speaks to the travel nursing being something that appeals to, well, perhaps younger people that don't have kids and that can really, pick up roots and take off at a moment's notice. Not everybody can do that, though. She said her unit is tight-knit and she cares about the patients she sees during her shifts. Mendoza was hospitalized for about 2 weeks early in the pandemic when she contracted COVID-19, and it gave her insight into how patients felt. It's why she tries to spend more time now talking to patients one-on-one during her rounds. And believe me, I can tell you that just having a colonoscopy done a couple of weeks ago, being ready to undergo anesthesia, and this isn't my first colonoscopy, but it's remarkable to me every time that when you see that propofol start to run in through the IV and you realize that I'm truly under the care of all of these people at the bedside. It brings it home as to how vulnerable you are as a patient and how you've given up all control. Still, she thinks the overall pay for a nurse should increase, and she thinks hospitals should provide additional pay as an incentive to pick up extra shifts. She notes that some nurses have gotten sick, while others with children had to take time off because of changes at schools and daycares. You have committed staff, you have staff that's loyal, that loves the place, loves the population, and you can't compensate them for the additional time that they stay and the risk of infection and all these things that other agencies and other institutions can compensate, Mendoza said. And that's the thing, that for a lot of us, we just can't all of a sudden make a big change and leave our job. And it's easy to say that you don't go into nursing to get rich, but on the other hand, you have to be honest with yourself that the type of work that you're doing is critical, it's valuable. Not everybody can do it, and it probably requires significantly more pay than what you're currently receiving. And that's the thing, not everyone is going to leave because things get rough, and some people will stay regardless of what the pay or the scheduling is. But I think for a lot of people, there was an opportunity now to take a look at your life and take a look at where you think you might be a few years from now. And this may have been the opportunity for some people to make some significant changes, whether it was starting a business or going back to school or just getting out of nursing altogether. And again, in some cases, retirement looked a lot more appealing to people during the pandemic for a variety of reasons. I think the moral of the story is stand up for yourself. Don't be afraid to ask for more money. Don't be afraid to ask for increased benefits. Don't be afraid to take time off when you need to take time off, because you need to take care of yourself. At some point, whatever additional pay and benefits the hospital might have given you during the pandemic is probably going to go away. And if and when that does, then I think the real crisis is going to occur. Because if the pandemic hasn't awakened anyone, certainly when they start taking pay away is when the Great Awakening will probably occur. Thanks for watching. I'm Will Martin, the Nurse Scientist channel. Please, if you can subscribe to the channel, I'd appreciate it. I'd appreciate a like, and certainly by all means, please leave some comments so that we can engage in some good discourse. Thanks very much. Bye.